Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. The NEET exam 2024. Today is 9th May. Still, we have 21 days, 3 weeks in this month, and 3 weeks next month. Almost 6 weeks, 42 days' time is still there. Things are in our hands. Let us join together. Every day, there is one NEETPG mock test. It contains 200 questions, 40 questions image-based, 160 questions are typically clinical vignette-based, just like the actual NEETPG. 100% sure shot strike rate in the tomorrow's NEETPG if you solve these 50 question papers. Each question paper PDF is made available on the learnograph.com as an ebook. You have 200 explanatory answers as 200 mind maps. Each mind map contains all the important points about that particular topic. So every day, what are you going to do? You're going to take a test, join the discussion, solve the paper, keep a timer, and get ready yourself. कहीं भी आप कोचिंग लो. It may be a face-to-face class, crash courses, apps, video libraries, whatever it is. But ultimately, you need to solve this 50 full-scale mock test to become the topper in the tomorrow's NEETPG exam. पूरा 50 full-scale mock test, 10,000 MCQs में, the 200 questions which are going to come in the exam are there. Very nice to see Abra, Alam, and many more who are all online. So, doctor, can you please punch us a voice loud and clear for all of you? So, doctor, a 40-year-old patient presents with an early onset of emphysema. She has a family history of liver disease. Family history of liver disease. Let me quickly put a word in the WhatsApp to all our friends. That the live class has started. So the mock test is absolutely free. The discussion on the YouTube. So take every opportunity to be part of this discussion. Already we finished 13 full-scale mock tests and their discussion and made the PDFs available on the learnograph.com. You have the link below for going and downloading the PDF of the full-scale mock test. So, doctor, 40-year-old, early onset emphysema, family history of liver disease, electron microscopy is also being presented to you. So this is the periodic acid shift stain after diastase digestion. It shows magenta cytoplasmic granules in the liver. You can see the magenta cytoplasmic granules, which represent the accumulation of the alpha-1 antitrypsin protein. And there is a dilatation of the endoplasmic reticulum, right, filled with that AAT, alpha antitrypsin protein. So this is a classical case of alpha-1 antitrypsin deficiency where the lung disease in the form of emphysema, family history of liver disease, together you need to recognize it in the tomorrow's NEETPG. So once more, in one single mind map, I'll give you the entire details of the alpha-1 antitrypsin deficiency that you need to remember. A 60-year-old female presents with a new onset headache, jaw pain when eating, tenderness on the temples, and the examination of the biopsy is being shown to you. So this is a case of temporal arteritis, new onset headache, jaw claudication, tender nodular temporal artery, multinucleated giant cells, right? When you do the temporal artery biopsy. And in all these cases, you need to immediately jump and start methylprednisolone. Even before the results of the biopsy come to you, you need to start the methylprednisolone. Otherwise, that lead to development of involvement of ophthalmic artery and development of the blindness. So everything about giant cell, what are diagnostic, histopathological, clinical features, treatment options, complications, everything you need to be sure. In one mind map, I give you all the key points for you to remember. Now, doctor, a 50-year-old man presents with the sudden onset of weight loss, fever, severe abdominal pain. So what you are able to see here, segmental fibrinoid necrosis, which is very classical of polyarteritis nodosa, with a thrombotic occlusion of the artery lumen is characteristic feature of polyarteritis nodosa is what you need to remember. A patient presents with persistent swelling in the legs, frothy urine, found to have proteinuria, kidney biopsy has been shown to you. So this is the typical Congo red staining the amyloid protein, obliterating the normal glomerular architecture. It is an amorphous eosinophilic material that show apple green birefringence under the polarized light, which is very classical of amyloidosis of the kidney is what you need to remember. 68-year-old with severe back pain with fatigue and recent history of recurrent infections. Bone marrow aspirate has been shown to you. So what are you able to see in the bone marrow aspirate, doctor? Monoclonal plasma cells have replaced, and many plasma cells show multiple nuclei, prominent nucleoli, increased size, and the cytoplasmic droplets that are containing the immunoglobulins are typically seen. So this is the case of multiple myeloma. So typically in the multiple myeloma, bone pain, fatigue, recurrent infections, renal failure, ultimately multiple myeloma patient dies in the hands of a nephrologist. Renal failure is the cause of death. Infections, they are easily succumbed to. They are the causes of mortality in case of the multiple myeloma. 60-year-old laboratory tests of serum protein electrophoresis are being shown to you. So what do you see here? Monoclonal immunoglobulin in the serum. And typically, single sharp band on serum electrophoresis showing immunoglobulin G, kappa light chains. Specifically indicate the monoclonal M protein, which is the classical feature of multiple myeloma, is what you need to remember. 30-year-old painless swelling of the cervical lymph node with intermittent fever. So what do you see here, doctor? Owl eye appearance. These are called Reed-Steinberg cells. It's a case of Hodgkin's lymphoma. 25-year-old woman, painless swelling in her neck, episodes of night sweats, biopsy done. There are collagen bands. You can see collagen bands. Lymph node is being separated into nodules. Lacunar Reed-Steinberg cells. They're all diagnostic of nodular sclerosis type of Hodgkin's lymphoma is what you should remember. During the labor, electronic fetal monitoring has been done. So what do you see here? Late decelerations. Always late decelerations are a sign of the fetal distress and tachycardia with absent variability. suggests uteroplacental insufficiency. The blood flow to the fetus is decreased. So in that context, what do you want to do? Prepare for immediate delivery is what you need to remember. So what should you do to become a topper? It's not how much you read important. It is not. It's not how much you read, how many months you read, how many sacrifices you made. Doesn't matter. What is important? Focus, focus, focus. What examiner want? If you look at the last 10 years of question papers of the NEETPG, INI-CET, FMGE, everything is one and same. Parampita, Paramatma, National Board, right? So if you look at retrospectively, there are hardly 1130 high-yield topics from which these 200 questions come. So there are about 50,000 high-yield facts that you need to master, right? So how do you know that what are the high-yield topics? If you did not receive it, today only, please WhatsApp our helpline number 900868 We will send you a free PDF of the 1130 topics from where the 200 questions come based on the retrospective analysis. So this 50 full-scale mock tests, each mock test PDF is available on the learnograph.com and download it, keep a timer, solve it every day. As you go forward, solve 2 papers every day, right? And wherever the questions you are going wrong, you download one PDF, you buy one PDF and share it to all your friends, no problem. But you do the revision, which is very, very, very important, right, Doc? So let's make a kill of these questions. So what you see here is during the labor, electronic fetal monitoring, late deceleration, fetal hypoxia. You need to emergently jump and do the prepare for the immediate delivery. 40-year-old presents with persistent fever, bleeding gums, a peripheral smear has been taken. So these are the large cells with folded nuclear membrane, with an abundant cytoplasm, with fever, gum hypertrophy, everything is indicative of AML with monocytic differentiation, which is called M5V under the FAB classification is what you need to remember. So ALL, AML, CML, CLL, HCL, hairy cell leukemia. Similarly, Hodgkin's lymphoma, non-Hodgkin's lymphoma. Just from these 7 topics, they are like 7 sisters. You get 4 to 5 questions. अगर नहीं आए तो मेरा नाम मुरली भारद्वाज नहीं है, right? In the tomorrow's NEETPG, everything you must be ready to crack in the tomorrow's exam. 62-year male, persistent anemia, undergoes a bone marrow biopsy. So what do you see in this bone marrow biopsy? Blue perinuclear granules on Prussian blue staining, right? So these are called ringed sideroblasts, which is the characteristic of myelodysplastic syndrome. With ringed sideroblasts is what you should remember. Now, doctor, 22-year-old female with abdominal swelling, discomfort. Imaging shows a mass in the liver, in the left ovary, and a biopsy has been shown to you. So what do you see in this biopsy, doctor? Typically, there are polyhedral cells with a clear cytoplasm, round nuclei, along with notable inflammatory response. This is all suggestive of dysgerminoma. Dysgerminoma is the counterpart of the seminoma in the males. Dysgerminoma in females is what you should remember. Once more, doctor, I leave the literature to you. What are the histopathological findings, clinical significance, treatment options for the dysgerminoma, everything you should know, complications and prognosis. In one mind map, you get everything, doctor, in the world that you need to know for the tomorrow's exam. 10-year-old child presents with a sore throat, fever, tender cervical lymph nodes. A throat swab culture shows gram staining. So what can you see on the gram staining, doctor? Gram positive cocci which are on in the form of chains. Similarly, bacitracin disc, when you kept it, nothing is growing around it. That means bacitracin sensitive. Bacitracin sensitive. Then you can also see the hemolytic pattern. It is beta hemolytic. Beta hemolytic, bacitracin sensitive, gram positive cocci, organized as chains. What else do you need? Streptococcus pyogenes is what you need to remember. Streptococcus pyogenes. Whereas Streptococcus pneumoniae presents like a diplococci and it lacks beta hemolysis. Staphylococcus aureus forms clusters and Haemophilus is a gram-negative bacillus. So one MCQ invariably comes on these culture characteristics of every organism, doctor. 34-year-old with persistent cough, weight loss, night sweats. HRCT is being shown to you. HRCT is shown to you. Tree in bud opacities. What are they called? Tree in bud opacities, which are typically seen in pulmonary tuberculosis, is what you need to remember. A 48-year-old presents with the wrist pain, deformity, testicular swelling, and a wrist radiography shown. It is showing multiple lytic lesions with osteopenia and absence of any joint space narrowing or osteophytes. Both wrist and testicular pain is there. So this is consistent with the skeletal tuberculosis is what you need to remember. So once more, skeletal TB, what is its radiological features, everything you should know for the tomorrow's exam, doctor. During a laboratory, a student observes a gram-stained slide as what you can see here. So blue-purple spherical cells in grape-like clusters after the gram staining is indicative of grape-like clusters means Staphylococcus aureus is what you should remember. A 63-year-old male with the lesions as what you can see here. This is called xanthelasma. So xanthelasma is multiple small bilateral yellowish blocks on the eyelids is called xanthelasma is what you need to remember, which is typically seen whenever the patient is having lipid disorder, lipid metabolism disorder, hyperlipoproteinemia is what you need to remember, right? So 1 second, doctor. I have a small call from the hospital. Yes, 42-year-old with the lesion of the face, which has been present since birth. The lesion has not changed in the shape, but has deepened in color. So what you're able to see, typically histology and the description fits into port wine, widely dilated blood-filled spaces which are capillaries that are enlarged and they do not regress. They are separated by fibrous septa, which is port wine stain, is what you need to remember. So, Sturge-Weber syndrome is the condition associated with port wine stain, is what you should remember. Port wine stain. Right, doctor? Now, a 12-year-old child presents with severe sun sensitivity. What does she present with? Sensitivity, photosensitivity. Very nice to see Abra Alam. Sir, I saw your videos. Although I am going to give FMG on 6th July, pray for me, sir. It helped me so much to solve MCQs. It gave me 50% more mileage to solve all expected questions. Thank you very much. So also Gokul and everybody. So I always tell that you should first know what examiner want. If you know what examiner want, then cracking entrance exam is a cakewalk, doctor, always. Always it is a cakewalk. Good. Rajiv rightly answers it as xeroderma pigmentosum. Absolutely, doctor. Absolutely. So keep guessing the answers and keep punching your answers. 12-year-old, extreme sun sensitivity, early onset of freckle-like pigmented spots on the face, multiple sunburns, characteristic of xeroderma pigmentosum, which is because of the pyrimidine dimer repair defect in the DNA, is what you should remember. 74-year-old man, rapidly growing lesion on his eyelid. The lesion is approximately 1 centimeter in diameter and it has changed in color in the past month. What is the likelihood? Dark pigmentation, dome-shaped, nodular, along with the loculation on the eyelid is nodular melanoma, is what you should remember. A patient presents with a blurred vision, eye redness, large greasy keratic precipitates. They are called mutton fat keratic precipitates कहते. ये कहाँ दिखता आपको? Granulomatous uveitis में large greasy white keratic precipitates called mutton fat keratic precipitates are typically seen after. 45-year-old ocular discomfort during slit lamp. You see the lesions on the iris, right? Nodular lesion on the iris. What are they called? Koyappi's nodules on the pupillary margins and Busacca nodules scattered on the surface of the iris. They're all indicative of typically granulomatous uveitis. Patient has eye pain, photophobia, redness during an eye examination. There are adhesions which are formed between the iris and lens. Along with eye pain, photophobia, redness, they're all indicative of anterior uveitis with the formation of posterior synechiae is what you should remember. 52-year-old, chronic low back pain, progressive stiffness, bamboo spine, sacroiliitis, they're all indicative of ankylosing spondylitis. 34-year-old, combination of skin lesions, which are able to see on the soles, right, doctor? Typical feature, which you are able to see on the soles. What is this called? Keratoderma blemorrhagica. Keratoderma blemorrhagica. Hyperkeratotic lesions resembling pustular psoriasis. Pustular psoriasis commonly seen in reactive arthritis, which was formerly called Rett syndrome, is what you need to remember. All right. Now, 40-year-old, typically with the lesions on the elbows and knees, along with joint stiffness in the hands and morning stiffness lasting more than an hour. This is classical of psoriasis with psoriatic arthritis, which is very deforming in nature, along with the nail dystrophy, is what you are able to see. A 10-year-old with juvenile idiopathic arthritis, band keratopathy, this is called band keratopathy, posterior synechiae, mature cataract, they are all typical features of the chronic anterior uveitis, which you see in case of the juvenile idiopathic arthritis, is what you need to remember, doctor. Very good, Rajiv. Keep punching your answers. Best way to do the revision. A patient with chronic diarrhea, abdominal pain, barium enema is being done. Painful skin lesions, as what you can see here, with a ragged border on the lower leg. What is the most likely diagnosis, doctor? It is ulcerative colitis. What do you see in this barium? Pseudopolyposis, loss of hostile markings, straightening of the ascending colon, presence of the pyoderma gangrenosum. They all point towards the ulcerative colitis, is what you need to remember. HIV positive, CD4 count is low, fundoscopy is being shown. So what do you see on the fundoscopy? Aggressive retinal necrosis. Aggressive retinal necrosis, extensive retinal whitening with hemorrhages in a HIV positive means cytomegalovirus retinitis is what you need to remember. Now, pediatric patient, mother had rubella. What is this called? Salt and pepper retinopathy, which is classical of rubella retinopathy. 38-year-old man presents with widespread symmetrical rash. You're able to see, doctor? Widespread symmetrical rash. It is spread on the trunk, the palms, and the soles. He reports mild fever, sore throat. So what is the most likely diagnosis, doctor? Secondary syphilis. Typically, anything about the syphilis, you need to be very sure, doctor. Patient reports a gradual vision loss, a recent increase in visual distortions, fundoscopy, fluorescein angiography is being shown to you. So the presence of elevated yellowish deposits under the retinal pigment epithelium with a moderate hyperfluorescence due to the staining in the late phase, which is all characteristic of drusenoid detachment of the retinal pigment epithelium. So drusen is extracellular material. It accumulates beneath the retinal pigment epithelium, leading to its separation from the underlying choroid, is what you have to identify. 68-year-old with a skin lesion which is being shown to you. History of otitis externa, erythema near the ear meatus. So what is this condition? Well-defined raised erythema is what you are able to see. which is very characteristic feature of erysipelas, which is typically caused by hemolytic streptococci, is what you should remember. A patient presents with a painful rash around the ear, facial paralysis on the same side, vertigo, hearing loss, classical of Ramsay-Hunt syndrome. Ramsay-Hunt, because it involves geniculate ganglion of the cranial nerve 7. It is more severe than Bell's palsy, right? Because Bell's palsy does not lead to any kind of rash or sensory symptoms, but Ramsay-Hunt lead to development of sensory symptoms. A 45-year-old man presents with a severe pain in the right ear. It worsens when he touches his ear. When the horoscope is inserted. So this lesion is there in the external auditory canal. So it is external auditory canal. Furuncle is what you should remember. Furuncle in the external auditory canal. Usually furuncles are caused by Staphylococcus aureus is what you should remember. A patient has a muffled hearing, sensation of fullness in the ear. Otoscopy shows the appearance of the tympanic membrane in the inferior part, mainly reduced mobility. So this is the otitis media with effusion, otoscopic appearance. A child with persistent hearing loss because the otitis media. So you have done myringotomy. Where do you give the incision, doctor? Posterior or superior quadrant is typically avoided to prevent injury to the ossicles. Right? So don't hit posterior or superior. Dangerous. DSP. Dangerous. Superior, posterior. Okay? Now, a newborn exhibits severe difficulty breathing immediately after the birth. So what you are able to see here, choanal atresia, and it requires immediate surgical intervention. A 6-month-old infant presents with a lesion which is being shown here. The lesion has been growing since the birth. The child is otherwise healthy. It is a case of hemangioma, facial hemangioma. A patient has a facial pain, nasal congestion, low-grade fever, endoscopic examination showing the pus adjacent to middle turbinate. So it is a maxillary sinusitis and the pus drains into the middle turbinate, presents with facial pain, nasal congestion and fever. So doctor, that brings us to the end of all the 40 image-based questions. So if you look the NEETPG question paper, the tendency is towards image-based clinical Binet type USMLE styled question papers. At least you can expect 50 to 60 image-based, but at least 40. So even in our mock test also, we give 40 image-based questions. Remaining 160 are typically clinical Binet-based questions. In our full-scale grand test, if you can score at least 150 out of 200 questions correctly, doctor, seat guarantee is my word. Okay, so every day I will become your classmate, roommate, benchmate, tablemate, studymate, hold your hand, inspire you. That is the purpose of a teacher. Teacher is not there to teach. All teaching is available in the notes. All teaching is there in your mind. No big deal. But what you need a strong classmate who challenges you every day. And that is the job I will do. You require a senior classmate, a senior who tells you what is 90% not to be read and only 10% that you need to read to crack 90% score in the tomorrow's exam. That is what is Dr. Murali Bharadwaj. So go to the learnograph.com. I leave the link below. We have all the PDFs of these mind maps, 200 mind maps in every question paper made available for you. Just go download. If you need it, share it with your friends, no problem. One of you pay and share it to 10 people, no problem. But all of you sit together, solve the paper, to consume the test paper. That is most important. हम जाके तिरुपति हुंडी में पैसे जैसे डालते हैं, ये कोचिंग में, वो कोचिंग में, ये ऐप में, वो ऐप में डाल देते, मगर पढ़ने के लिए कौन मोटिवेट करेगा? वो मोटिवेट करेगा डॉक्टर मुरली भरद्वाज. All right, doctor. So let's take up some more questions before we say goodbye. 63-year-old, history of hypertension, smoking. So the carotid sinus contains baroreceptors that sense the changes in the arterial blood pressure. Any sudden onset of the neurological deficits with high blood pressure, it suggests a possible stroke, and the carotid sinus would detect the elevated blood pressure. 12-year-old girl typically presents with the clinical features: photosensitive rash, intermittent ataxia, diarrhea, amino aciduria. So that all suggest Hartner's disease, where there is a defective transport of the neutral amino acids and niacin deficiency due to the wasting of tryptophan. Tryptophan is converted to niacin, vitamin B6. Niacin with vitamin B6 as the cofactor is what you need to remember. 3-year-old boy with a history of the mild asthma. So what is the mediator that increases the bronchial tone, leading to bronchoconstriction, leading to asthma exacerbation? Leukotriene C4 is what you need to remember. So you should know everything about cyclooxygenase, lipoxygenase pathway. One MCQ comes on the prostaglandins, doctor. Be very, very sure about. Paresthesias, hypohidrosis, heat intolerance, angiokeratomas with normal laboratory findings such as Fabry's disease, alpha galactosidase A deficiency. Now, the primers are complementary to the target DNA sequence and anneal to the respective 3 ends. So that is the reason you should know the primer which will amplify the DNA segment, what will be its sequence based on the complementariness. I'll leave the literature for you. Now, so Chargaff's rule, you should be very sure. Adenine binds with thymine, guanine, and cytosine. You need to be very sure. Now, Mycoplasma pneumoniae lacks a cell wall, so that the antibiotics that target the cell wall synthesis are ineffective, like ceftriaxone. So macrolides like azithromycin are effective on mycoplasma. So the story of mycoplasma of a typical pneumonia given to you. How does mycoplasma work? They inhibit the protein synthesis by binding with the 50S ribosomal subunit. So every NEETPG exam, one MCQ comes on what is the mechanism of action of the various antibiotics. You need to be very sure about. The patient has a strong family history of a early onset colorectal carcinoma. So hereditary non-polyposis colon cancer is due to mismatched repair system, leading to microsatellite instability and a early onset colorectal cancer. 17-year-old girl with hypertension, no menses. So whenever 17-alpha hydroxylase is deficient, it leads to decreased sex steroids, decreased cortisol, accumulation of the mineralocorticoids, leading to hypertension and lack of secondary sexual characters is what you need to remember. So once more, congenital adrenal hyperplasia. Every NEETPG exam you go, doctor, one MCQ, sure shot to come. A patient with rheumatoid arthritis with macrocytic anemia, high MCV, neurological symptoms. So typically pernicious anemia, it is due to anti-parietal cell antibodies is what you should remember. So 5-month-old girl with heart enlargement, muscle weakness, liver enlargement and joint QRS complexes. It is the POMP disease, lysosomal alpha 1A, 1,4, glucosidase deficiency leading to glycogen accumulation in the heart is what you need to remember. So 2-year-old tendon xanthomas, corneal arcus, elevated LDL cholesterol, typically familial hypercholesterolemia. It is due to the mutation of the LDL receptor gene is what you should remember that. So each of the hyperlipidemias, what is the fundamental problem and deficiency, you should be very sure. A term infant, vomiting, lethargy, after you have changed from breast milk to formula containing fructose. So it is aldolase B. So it's called hereditary fructose intolerance when the child is first introduced to fructose, which is in the baby formula. So aldolase B deficiency lead to accumulation of fructose 1-phosphate that lead to the sequestration of the inorganic phosphate. If the inorganic phosphate is not available, then there is a depletion of the ATP that lead to hypoglycemia, vomiting, lethargy, aversion to the sweet foods, etc., etc. Now, 6-month-old infant is brought to the clinic with 2-day history of constipation, poor feeding. Infant is lethargic, weak cry. Mother says honey is using honey to sweeten the infant's porridge. What is the likely cause? So ingestion of honey containing Clostridium botulinum spores is responsible for the infant botulism is what you need to remember. A 34-year-old constructional worker. So typically it is a case of coccidomycosis. Spherules in the sputum culture at 37 degrees Celsius is indicative of coccidioides species. Fever and rash in the first trimester suggests rubella infection. Malt lymphoma is associated with H. pylori. Rapid onset of the symptoms in case of food poisoning is Bacillus cereus, especially reheated rice is a clue to say it is Bacillus cereus. I did to run little fast because that is the only way you can cover. My job is before you come to the class, try to solve the questions by yourself. Then you will enjoy this discussion. History of IV drug abuse is a risk factor for typically hepatitis C virus infection. So 2-year-old, widespread redness, skin, fever, peeling of the skin on the trunk, all these suggest of staphylococcal scalded skin syndrome. Exotoxin binding to desmoglein 1 leading to the separation of the epidermal cells is the underlying cause. Bloody diarrhea after consumption of an undercooked meat, classical of E. coli O157H7, associated hemolytic uremic syndrome. So what is the triad of hemolytic uremic syndrome, doctor? Anemia, thrombocytopenia, and renal injury is what you have to remember. Pregnant women with the blood type of O negative. So you need to remember, indirect Coombs test is the one which checks the presence of the antibodies against the Rh positive blood in the Rh negative mother's serum is what you need to remember. So positive indirect Coombs test is done in the Rh negative woman to discover the sensitization. So typically the patient after taking vancomycin developed the allergy. It is called Redman syndrome. So it is not mediated by preformed IgE antibodies, which is characteristic of type 1 hypersensitivity, but it is a non-IgE mediated mast cell and basophil degranulation. That's the reason this is not called anaphylaxis. It is called anaphylactoid reaction. The red man syndrome after taking the vancomycin. So I leave the literature for you. Anything about red man syndrome, along with different types of hypersensitivity. Definitely one MCQ is going to come. 2-year-old girl not vaccinated develops high fever, difficulty in breathing. So, whenever you vaccinate against H influenza, it is the type B capsule, which is a major virulence factor essential for immune recognition, which is used to create the vaccine. 46-year-old male received the kidney transplant. Right in the operation theater, there is a development of rejection. Such a rejection is called hyperacute rejection, which occur because of the preformed antibodies. So, hyperacute, acute, chronic, graft versus host disease, everything you need to be very sure, doctor. I leave the literature for you in the form of a one single mind map में आपको सब कुछ मिल जाएगा. Now, 6-month-old infant, recurrent otitis media, oral candidiasis, tetany, hypocalcemia, underdevelopment of thymus gland. और कुछ चाहिए क्या? This is Dysgerminoma syndrome. It is the T cell deficiency that lead to recurrent infections is what you need to remember. Now, all the clinical features, 3-year-old girl, new onset seizures, inappropriate parietal laughter, microcephaly, deep set eyes, large mouth, protruding tongue, unstable guide. So this all suggests of Angelman syndrome, which is abnormal imprinting is what you need to remember. Bhaiya, imprinting क्या होता है? Imprinting is a genetic phenomena where the phenotype is expressed or not depends on whether the mutation is inherited from बाप से मिला mutation नहीं तो माँ से मिला. किससे मिला will decide कैसे phenotype बाहर निकलेगा. That is called imprinting is what you need to remember. So Prader-Willi syndrome, Angelman syndrome, everything you need to be very sure about, doctor. 51-year-old with recurrent vomiting, sometimes bloody, cannot recall when the symptoms have started. He had multiple sexual partners, frequent alcohol consumption. So he has alcoholic liver disease. उसमें क्या मिलता है liver biopsy में? Melanoma bodies are commonly seen, which are cytoplasmic inclusions found in the liver cells in the case of the alcoholic liver disease is what you need to remember. Large epithelioid cells and granulomatous inflammation. Where do you see that? Mycobacterium. Radio-opaque stones, urolithiasis. Typically, alkaline urine, pH more than 7.2. That is the type of urine that prefers the precipitation of calcium phosphate crystals and stones. So, HIV patient, low CD4, multiple organs, biopsy shows typically the characteristic appearance. It's all the features of Cryptococcus neoformans. Cryptococcus neoformans is what you should remember. 50-year-old dyspnea on exertion, lower extremity, edema, orthopnea, new onset diabetes, testicular atrophy, bronze diabetes, hereditary hemochromatosis. 37-year-old HIV positive, long-standing anogenital lesions, recent onset blood in stool, weight loss, palpable rectal mass, metastatic liver lesions, hyperkeratotic papules on the genitalia. So you should think of the possibility of the actually HIV positive HIV positive neoplasms, right? You need to, it's a topic, I leave the literature for you. 5-year-old girl, boy, unsteady gait, vertigo, nausea, CT shows lesion in the brain. So which area of the brain is affected, doctor? Unsteady gait, vertigo, cerebellar dysfunction. It is the cerebellar vermis which controls the axial and proximal limb coordination, which affects the gait and the stance. Retired shipyard worker. शिपयार्ड विशाखापट्टनम बोलते ही आपके माइंड में आ जाना एस्बेस्टॉस. So fatigue, shortness of breath, clubbing along with the holosystolic murmur and cyanosis means it is no more left to right. It is a right to left shunt is what you should identify. So doctor, that brings us to the end of today's discussion. What is important? That only 200 questions in the PDF. Right away, go to learnograph.com, download the PDF of every question paper, right? Solve the paper. 200 mind maps are being given, and do the revision. And once more, come tomorrow for the next NEETPG mock test. Totally 50 NEETPG mock test practice, 10,000 MCQs, from which short 200 MCQs are going to come in the tomorrow's NEETPG. Good night and enjoy the preparation.